All right, we're back, and we said we wanted to take a look at some of the more definitive patient packaging options that we have. Before we dive into the first one, which will be the LSP halfback, we want to talk just for a brief moment about some of the other patient care issues, in particular the need or the desire for us to get an air supply on our patients. So kind of just as a reminder, once you make initial contact with your patient in the confined space, you're going to do a quick assessment of their condition, because remember that incident commander is looking for information to update his action plan. Are we changing from rescue mode to recovery mode? Well, that'll be based on your patient assessment. So assuming we're still in the rescue mode, we're going to want to get an air supply on our patient. So that means getting a face piece on them and getting a regulator connected to them. Remember, when you're installing that face piece, you want to get their chin in place and then pull the head net all the way over to the back of their head, almost down to below the projection on the back of their head, and then get it cinched up and snugged up so that you eliminate as much as possible any potential leaks in the seal. Then you're going to, of course, get your regulator connected to them and get it clicked in. As they start to take a breath, then of course they'll be receiving an air supply. The cylinder will typically be positioned just off their head, with the hose coming out what is ultimately the top of normally the top of the cylinder, so that you have enough leash or enough hose to work with here as you manipulate that patient. So keep that in mind. You're going to want to practice using that air supply as much as possible. However, today for our little demonstration, we're going to remove that so that you can see a little more clearly and focus on the patient packaging side of things as well. But don't overlook that in your training, all right? So we'll remove that, and we'll get that out of the way a second, and then we will look at the LSP halfback.